there! Ready for a wellness adventure? Let's explore the world of health together.
An HMO plan is one of the most structured types of health insurance systems used in modern healthcare to organize costs, provider access, and patient treatment pathways efficiently. The letters HMO stand for Health Maintenance Organization, a model designed to coordinate healthcare through controlled provider networks and centralized medical management systems for members. Government health agencies explain that HMO plans were created to reduce unnecessary healthcare spending while improving preventive care and long-term patient health management across populations. One of the most important features of an HMO plan is the requirement to select a primary care physician, commonly called a PCP, after enrollment begins. The primary care physician becomes the patient's main healthcare provider and acts as the first contact for routine medical concerns, preventive care, and health monitoring appointments. Instead of visiting specialists directly whenever symptoms appear, patients usually begin by consulting their primary care physician first for evaluation and treatment recommendations under HMO systems. The primary care physician evaluates symptoms, reviews medical history, orders initial tests when necessary, and determines whether referral to a specialist is medically appropriate for treatment. Government healthcare institutions describe this structure as coordinated care because healthcare decisions move through a central physician responsible for managing the patient's overall treatment pathway. For example, if someone develops recurring stomach pain, the primary care physician may first investigate dietary causes before referring the patient to a gastroenterologist specialist. This system helps reduce unnecessary specialist appointments, duplicate testing, and fragmented healthcare management that can increase healthcare costs without improving medical outcomes significantly. Public health agencies explain that coordinated care often improves communication between providers because the primary physician maintains oversight of medications, diagnoses, treatments, and referrals simultaneously. The HMO structure also encourages continuity of care because the same physician follows the patient's medical history over long periods instead of isolated independent appointments. Continuity becomes especially important for chronic conditions such as diabetes, hypertension, asthma, or heart disease, where long-term monitoring strongly influences patient health outcomes. Government medical institutions consistently report that patients with coordinated long-term care often experience fewer preventable complications and lower hospitalization rates compared with fragmented treatment systems. Another defining characteristic of HMO plans involves provider networks, which are groups of doctors, hospitals, clinics, pharmacies, and laboratories contracted with the insurance company. These providers agree to negotiated pricing structures and administrative rules in exchange for access to the insurer's patient population through the health insurance network system. Because providers accept negotiated payment rates, insurers can better predict healthcare spending and maintain lower monthly premiums for HMO members compared with less restrictive insurance plans. Public health economists explain that tighter provider control allows HMO systems to reduce unnecessary healthcare utilization while maintaining organized treatment pathways for insured patients. Most HMO plans require members to receive non-emergency medical care exclusively from in-network providers unless special authorization is granted by the insurance company beforehand. If a patient chooses an out-of-network provider without authorization, the insurance plan may refuse coverage entirely, leaving the patient responsible for the full medical bill independently. Government consumer protection agencies strongly encourage patients to verify provider network participation before scheduling appointments because network restrictions significantly affect healthcare costs under HMO plans. Emergency care follows different rules because many healthcare laws require insurance companies to cover emergency treatment regardless of network participation during urgent medical situations. These protections exist because delaying emergency treatment while verifying network participation could place patient health or survival at serious unnecessary risk during critical situations. HMO plans also rely heavily on referral systems to regulate specialist access and coordinate medical treatment through primary care physicians responsible for managing patient healthcare journeys. For example, a patient experiencing persistent knee pain may first visit their primary physician before receiving referral approval to consult an orthopedic specialist within the network. The referral process allows the primary physician to determine whether specialist care is necessary or whether simpler treatment approaches may resolve the medical issue successfully first. Government health agencies explain that referral systems help reduce healthcare costs because specialist appointments and advanced procedures are usually more expensive than primary care visits. Referral systems also improve coordination because specialists receive patient information, medical history, and prior test results directly from the referring physician before consultation begins. This communication reduces repeated testing and helps specialists understand the patient's broader medical background before recommending advanced treatments or diagnostic procedures during appointments. Preventive healthcare services represent another major focus within HMO plans because preventing disease generally costs less than treating advanced medical conditions later in life. Many HMO plans cover preventive services with little or no additional patient cost sharing to encourage regular health monitoring and early disease detection among members consistently. Preventive services commonly include annual physical examinations, vaccinations, blood pressure screenings, cancer screenings, cholesterol testing, and wellness counseling visits with healthcare providers regularly. Government public health institutions consistently emphasize that preventive care reduces long-term healthcare spending while improving overall population health outcomes through earlier treatment interventions and monitoring. For example, detecting high blood pressure during a preventive examination may prevent future strokes, heart attacks, kidney disease, or other serious complications requiring expensive hospitalization later. HMO systems often integrate electronic medical records that allow providers within the network to share patient information more efficiently across clinics, laboratories, and hospitals simultaneously. Integrated medical records improve communication between healthcare professionals and reduce the likelihood of conflicting medications, duplicated procedures, or incomplete medical information during treatment coordination. Government healthcare technology agencies recognize integrated digital records as important tools for improving patient safety and reducing administrative inefficiencies within coordinated healthcare systems nationwide. Prescription medication coverage within HMO plans usually operates through network pharmacy systems, designed to standardize medication pricing and encourage efficient prescription management for members. Patients are generally encouraged to fill prescriptions at participating pharmacies, where negotiated pricing agreements lower medication costs for both insurers and insured. Individuals using covered medications. Formularies organize medications into coverage categories that determine patient copays, preferred medications, and approval requirements for certain prescription drugs within the insurance plan. Government health regulators require insurers to disclose formulary information clearly so patients understand which medications are covered and how prescription cost-sharing structures operate under their plan. Another important feature of HMO systems involves predictable healthcare costs, because coordinated provider networks create more standardized billing structures for routine medical services and treatments. Patients often know in advance what copay or coinsurance amount applies for common services such as primary care visits, specialist consultations, or prescription medications under network rules. This predictability can help families budget healthcare expenses more effectively because unexpected billing variations are generally reduced within coordinated in-network healthcare systems. Public consumer education programs note that HMO plans are often attractive for individuals seeking lower premiums, predictable costs, and organized healthcare coordination rather than maximum provider flexibility. However, some patients consider network restrictions and referral requirements disadvantages because they prefer direct access to specialists or broader provider choice without administrative approvals beforehand. For example, someone accustomed to independently selecting specialists may find HMO referral requirements restrictive or inconvenient compared with less structured insurance plan types available elsewhere. Travel can also create challenges for HMO members because network providers are often concentrated within specific geographic regions where the insurer maintains contractual provider relationships locally. Individuals who travel frequently or live in rural areas may experience limited network availability, making access to participating providers more complicated outside their primary service area. Government health regulators therefore review network adequacy standards to ensure HMO members maintain reasonable geographic access to physicians, hospitals, specialists, and pharmacies near their residence. Some HMO systems operate closely with integrated hospital systems and physician groups that coordinate treatment, administration, and insurance operations within a unified healthcare organization structure. These integrated systems can improve communication efficiency because providers, hospitals, And insurers often share centralized administrative and electronic record management systems for patient coordination. Public healthcare policy institutions explain that integrated HMO models are designed to emphasize preventive treatment, coordinated care, predictable costs, and efficient healthcare resource utilization simultaneously. Despite limitations in provider flexibility, HMO plans remain one of the most common insurance structures because they balance affordability, preventive care, and coordinated treatment management across large populations. Understanding how HMO systems function helps patients evaluate whether they prefer organized care coordination and lower costs or broader provider access with fewer administrative restrictions. A PPO plan is a type of health insurance designed to provide greater flexibility when choosing healthcare providers, specialists, hospitals, and treatment locations for medical care. The letters PPO stand for Preferred Provider Organization, a system that combines provider networks with more patient freedom compared with highly structured HMO insurance plans. Government health agencies explain that PPO plans were created for individuals who want broader provider access without strict referral requirements controlling specialist consultations and treatment pathways. Like other insurance systems, PPO plans still use provider networks composed of doctors, hospitals, laboratories, pharmacies, and clinics contracted with the insurance company through negotiated agreements. These negotiated agreements establish discounted service prices for plan members who choose providers, participating within the PPO network structure established by the insurance company. The key difference is that PPO plans usually allow patients to receive care both inside and outside the provider network without requiring complete loss of coverage benefits. In-network providers still offer the most favorable pricing and cost-sharing conditions, because negotiated rates reduce healthcare expenses for both the insurance company and the insured patient. However, PPO members generally maintain the option to visit out-of-network providers if they are willing to pay higher deductibles, coinsurance, or remaining uncovered balances afterward. Government consumer protection agencies explain that PPO plans trade higher monthly premiums for increased provider freedom and reduced administrative restrictions during healthcare decision-making processes. One of the most important features of PPO plans is the absence of mandatory primary care physician coordination for most healthcare services and specialist consultations. Unlike HMO systems, PPO members usually do not need referrals before scheduling appointments with specialists such as dermatologists, cardiologists, neurologists, or orthopedic physicians independently. For example, if someone develops recurring skin irritation, they can usually schedule an appointment directly with a dermatologist without first visiting a primary care physician. This direct specialist access is often viewed as one of the largest advantages of PPO insurance plans because patients maintain greater control over healthcare decisions independently. Government healthcare policy institutions explain that PPO flexibility appeals particularly to individuals who value provider choice, frequent travel flexibility, or independent healthcare management preferences strongly. However, this flexibility usually comes with higher insurance costs because insurers have less control over healthcare utilization patterns and specialist access under PPO structures. Public health economists note that unrestricted specialist access may increase healthcare spending because patients can seek advanced consultations more frequently without centralized medical coordination systems. Despite higher costs, many patients prefer PPO structures because they allow broader provider selection and reduce administrative delays associated with referral approval processes found in HMO plans. PPO plans still encourage members to remain within the preferred provider network through lower deductibles, lower copays, and lower coinsurance percentages for in-network medical services. For example, a PPO member may pay 20% coinsurance for in-network hospital care but 40% coinsurance for identical services received outside the network. Government health regulators require insurers to disclose these cost differences clearly so policyholders understand how provider selection affects overall healthcare expenses under PPO coverage structures. Out-of-network coverage is one of the defining characteristics, separating PPO plans from many HMO systems where non-emergency outside care often receives no coverage whatsoever. Even though PPO plans may partially cover out-of-network services, patients usually face significantly higher financial responsibility when using providers without network agreements established beforehand. Out-of-network providers are not required to accept the insurer's negotiated reimbursement rates because no contractual agreement exists between the provider and the insurance company. As a result, Patients may encounter balance billing situations where the provider charges more than the insurance company reimburses for a medical service or procedure performed. Government consumer protection agencies warn that balance billing can create unexpectedly high medical expenses. If patients do not verify provider network participation before receiving non-emergency treatment, PPO plans therefore provide flexibility, but that flexibility carries financial trade-offs patients must understand carefully when making healthcare decisions or selecting treatment providers independently. Another major advantage of PPO systems involves geographic flexibility for individuals who travel frequently or live across multiple locations during the year for work or personal reasons. Because PPO plans often maintain broader provider networks and include some out-of-network coverage, traveling members usually retain greater healthcare access compared with stricter HMO structures. For example, a business traveler receiving non-emergency care outside their home state may still obtain partial coverage through a PPO plan despite visiting an out-of-network provider. Government health policy experts note that PPO structures can therefore provide greater convenience for mobile populations requiring broader regional or national provider access consistently. PPO plans also commonly appeal to individuals already receiving treatment from physicians who may not participate within narrow HMO network systems available in certain geographic regions. Patients with chronic medical conditions sometimes prefer PPO plans because changing long-term physicians or specialists can disrupt treatment continuity and medical record consistency over time. Public healthcare agencies emphasize that continuity of care remains important for managing chronic illnesses such as cancer, autoimmune diseases, diabetes, neurological disorders, or complex cardiovascular conditions. The flexibility of PPO plans may therefore help patients maintain established provider relationships without completely losing insurance support for medically necessary healthcare services received regularly. Prescription medication coverage within PPO systems usually operates through preferred pharmacy networks similar to other insurance plan structures, currently used throughout healthcare systems nationally. Patients generally receive lower medication costs when using network pharmacies because insurers negotiate pricing agreements with participating pharmacies and pharmaceutical benefit management systems directly. Government health regulators require PPO plans to disclose formulary structures explaining medication tiers, coverage conditions, copays, and authorization requirements affecting prescription drug access. Another important aspect of PPO systems involves claims processing for out-of-network services because administrative responsibilities may differ from standard in-network billing procedures significantly. In-network providers usually submit insurance claims directly to the insurer because they already operate under established contractual administrative systems with the insurance company network. Out-of-network providers, however, may require patients to pay upfront before independently submitting reimbursement claims to the insurance company afterward for partial repayment consideration. Government consumer education programs encourage PPO members to understand reimbursement procedures carefully because claim submission responsibilities can vary depending on provider participation status and plan design. PPO plans also usually maintain annual deductibles and out-of-pocket maximums that determine how much patients pay before insurance coverage reaches its highest reimbursement level. Some PPO structures maintain separate deductibles for in-network and out-of-network care, creating different cost-sharing systems depending on where treatment is received during the plan year. Government insurance regulators require insurers to explain clearly how these separate deductibles operate, because misunderstanding them can create unexpected financial obligations for patients unexpectedly. Like other insurance systems, PPO plans emphasize preventive healthcare services designed to detect diseases early and reduce long-term healthcare complications among insured populations effectively. Routine screenings, vaccinations, wellness visits, and preventive testing are often covered with reduced patient cost sharing to encourage regular healthcare monitoring and early medical intervention practices. Public health institutions consistently report that preventive care improves population health outcomes while reducing future hospitalization rates and long-term treatment costs across healthcare systems broadly. Despite higher premiums, PPO plans remain extremely popular because many individuals prioritize healthcare flexibility, specialist access, provider choice, and reduced administrative restrictions over lower monthly insurance costs. Government healthcare analysts explain that PPO structures reflect a balance between organized network pricing and consumer freedom within increasingly complex healthcare delivery environments nationwide. Understanding PPO plans helps individuals evaluate whether greater provider flexibility justifies higher premiums and potentially larger out-of-pocket health care expenses during medical treatment and specialist care. Next, EPO and POS plans are health insurance models designed to combine elements from both HMO and PPO systems while balancing provider flexibility, cost control, and coordinated medical care. Although these plans are less widely understood than HMOs or PPOs, government health agencies classify them as important hybrid insurance structures within modern healthcare systems nationally. The letters EPO stand for Exclusive Provider Organization, while POS stands for Point of Service. Two systems combining network-based coverage with different levels of patient flexibility. Both EPO and POS plans attempt to balance affordability with provider access by creating structured healthcare pathways without fully eliminating patient choice during medical treatment decisions. Understanding these hybrid insurance models helps individuals compare healthcare options more accurately when selecting plans through employers, government marketplaces, or private insurance systems independently. An EPO plan functions similarly to an HMO in one important way because members are generally expected to use providers within the insurance network for non-emergency medical care. However, unlike most HMO systems, EPO plans usually do not require referrals before visiting specialists, creating greater flexibility for patients seeking specialized healthcare services directly. For example, a patient experiencing persistent migraines may schedule an appointment directly with a neurologist without first consulting a primary care physician for referral approval beforehand. Government healthcare policy institutions explain that EPO plans were developed to provide specialist flexibility while still controlling healthcare costs through strict provider network limitations consistently. Because EPO plans eliminate most out-of-network coverage, insurers maintain stronger control over negotiated provider pricing and healthcare spending throughout the insurance system structure overall. This network restriction allows EPO plans to often maintain lower monthly premiums compared with PPO plans offering broader out-of-network coverage and greater provider access flexibility nationally. Public health economists note that restricting coverage primarily to network providers helps insurers predict claims costs more accurately and stabilize long-term healthcare spending patterns effectively. Like HMO systems, EPO plans usually provide emergency coverage regardless of network participation because government healthcare laws require protection during urgent medical situations and emergencies. Outside emergency situations, however, non-network medical care is often not covered under EPO plans, leaving patients responsible for the full treatment cost independently afterward. Government consumer protection agencies therefore strongly encourage EPO members to verify provider participation carefully before scheduling appointments or receiving non-emergency healthcare services anywhere consistently. One advantage of EPO plans involves administrative simplicity because patients can access specialists directly without navigating formal referral systems commonly associated with traditional HMO insurance structures. This flexibility appeals to individuals who prefer independent healthcare management but still want lower monthly premiums than those commonly associated with broader PPO insurance coverage systems. EPO plans also commonly maintain coordinated provider networks where physicians, specialists, hospitals, laboratories, and pharmacies operate under negotiated administrative and reimbursement agreements together efficiently. These integrated networks can improve communication between healthcare professionals and reduce duplicated testing, conflict in treatments, and fragmented medical record management during patient treatment coordination processes. Government public health agencies recognize coordinated provider systems as important tools for improving treatment efficiency and continuity of care within structured healthcare delivery environments nationally. However, the limited out-of-network coverage within EPO systems can become challenging for individuals traveling frequently or living in regions with fewer participating providers available nearby. Patients receiving treatment outside the network without emergency justification may face substantial medical bills because insurers usually deny non-network claims entirely under EPO coverage structures commonly. This creates a trade-off between affordability and provider freedom that patients must evaluate carefully when selecting between EPO, HMO, or PPO insurance plan types available locally. POS plans operate differently because they combine characteristics from both HMO and PPO systems within a single insurance structure designed for moderate flexibility and coordinated care simultaneously. The letters POS stand for point of service because the patient's costs depend partly on where healthcare services are received during the treatment process under the insurance plan. Like HMOs, POS plans usually require members to select a primary care physician responsible for coordinating healthcare management and specialist referrals throughout the treatment process consistently. The primary care physician acts as the central healthcare coordinator and helps manage preventive care, routine treatment, referrals, diagnostic testing, and specialist consultations for insured patients effectively. Government health institutions explain that this coordinated structure helps reduce unnecessary healthcare utilization, while improving continuity of care for long-term medical conditions and preventive healthcare management. However, unlike traditional HMO systems, POS plans usually include some level of out-of-network coverage for patients, choosing providers outside the preferred insurance network structure available locally. This creates more flexibility than HMOs because patients can still obtain partial insurance reimbursement for certain non-network healthcare services when necessary or preferred personally afterward. For example, a POS member may decide to visit an out-of-network dermatologist despite paying higher deductibles and coinsurance for receiving non-network specialist treatment independently afterward. Government consumer education programs explain that PS plans therefore function as intermediate systems positioned between highly restrictive HMOs and more flexible but expensive PPO insurance structures. When patients follow the coordinated referral pathway within the network, healthcare costs are usually lower because negotiated provider pricing and standardized billing structures apply consistently during treatment. If patients choose to bypass the network or ignore referral procedures, their financial responsibility generally increases through higher deductibles, copays, and coinsurance obligations under the PS plan. Public health economists describe POS systems as financial incentive models, encouraging coordinated network care without fully removing patient choice regarding provider selection and specialist access opportunities. Like other insurance systems, POS plans maintain provider directories listing participating physicians, hospitals, laboratories, pharmacies, and specialty treatment facilities available within the preferred network structure locally. Government health regulators require insurers to update these provider directories regularly so patients can verify participation status before scheduling healthcare appointments or specialist consultations confidently. Prescription medication coverage in POS systems usually functions through network pharmacy agreements, similar to HMO and PPO insurance structures commonly used throughout healthcare markets nationally today. Patients generally receive lower medication costs at participating pharmacies because insurers negotiate pricing agreements with pharmacies and pharmaceutical benefit management systems directly for plan members. Government healthcare agencies require insurers to disclose formulary structures clearly so patients understand medication coverage tiers, copays, authorization requirements, and pharmacy network rules appropriately beforehand. Another important aspect of PA's systems involves referrals because specialist coverage within the network often depends on obtaining proper authorization through the assigned primary care physician first. Without required referrals, certain specialist services may receive reduced reimbursement or no coverage under the plan's administrative rules, governing coordinated healthcare management pathways specifically. This referral requirement encourages communication between primary physicians and specialists while helping insurers manage healthcare utilization patterns and treatment coordination processes more effectively across populations. POS plans may therefore appeal to individuals wanting moderate flexibility while still maintaining lower premiums than many PPO plans commonly available through employer-sponsored healthcare systems nationally. EPO plans, by comparison, generally appeal to individuals comfortable remaining inside provider networks but wanting direct specialist access without mandatory referral coordination procedures or administrative delays. Government healthcare policy experts explain that these hybrid insurance models exist because different individuals prioritize different combinations of cost, provider freedom, coordination, and administrative simplicity differently. Some patients value affordability and organized healthcare coordination, while others prioritize specialist flexibility, broader provider choice, or partial out-of-network coverage protections during treatment decisions personally. Understanding EPO and POS structures helps individuals compare insurance plans beyond monthly premiums alone because network rules strongly affect long-term healthcare access and financial responsibility outcomes. Choosing between these plans ultimately depends on how much provider flexibility, referral coordination, travel convenience, and predictable healthcare costs a person prefers within their insurance coverage structure overall. Thanks for watching World Wellness Care and Coverage.
Thanks for watching. Hope you liked it.